The ABCs of LGBTQ. I'm Dr. David, and welcome to Your Health, Your Choice. So today we are going to be talking about a topic that is very personal to me due to my involvement with my friends and members of my family in the LGBT community. And I realized that even my own self, some of the terms that are being that are used in the acronym itself, as well as how people identify, it can be confusing, it can be nebulous, and I had to do some learning myself about this topic. Now, the health aspect of what we're talking about today a little on is with the health aspect, especially in terms of the impact on mental health that is being seen in a very specific way in the LGBT community. We are also going to be educating just about what these different terms mean, and also relative to choice. Now, people who are in the LGBT community, this isn't a choice for them. This is who they are. The choice is how we and how others educate ourselves, how we interact with those in the LGBT community, how we speak about people as well. So we all have that choice. And of course, educating ourselves is the first and foremost way to make sure that we are saying things that isn't hurtful, that, it's just even some basic things can sometimes come out wrong and can hurt somebody, and we may not be aware of it. Joining us today is Shari Kulanu, who is the executive producer of our show, as well as the executive director of my practice. So, Shari, welcome today. How are you?
Great. It's so great to be back on the show. It's been a while.
It has been a little while. It's good to see you again, since I never ever get to see you. So that's great. Yeah. So I'm going to have you kind of start off with this topic a little bit, and we'll go from there.
All right, cool. So we wanted to, as we say, the name of the show is the ABCs of LGBTQ, just so we get a lot of letters in there. We're going to start by just talking about the most commonly used acronym that we hear, which is LGBTQ. We're going to talk about what those letters mean. We do want to say that there are other acronyms that are used. This in no way is meant to be intending to be dismissive or exclusive of anybody else. We're going to start by just talking about these most common letters, and there'll be some links down below that will help further explain some of these topics as well. So, David, let's just have you start by giving some of the more common generalized definitions of the various letters in LGBTQ.
Certainly. So the information that I'm going to provide, this is actually from the LGBT Community Center, the Gay Center, which is one of the gaycenter.org that people can find this. This information will also be located in the notes down below, so you can certainly look this up for more information. I'm going to also refer to my notes here because this is so important to get right that I am going to cheat a little bit here and not do this completely by memory, although I think I have it, but I want to make sure that I get it right for everybody. Now, the term lesbian, we'll go in the order of the letters here. So this is a woman who's enduring physical, romantic, and emotional attraction is to other women. Okay, so some lesbians may consider themselves gay, and they may consider themselves a gay woman. But in general, that's what the term lesbian is specifically speaking about: a woman who has those types of attractions towards other women. Now, gay. Now, this is more about a more general term, as you may have implied from that where people who have enduring physical, romantic, and or emotional attractions are to people of the same sex as them. And again, some lesbian people will use this term as well to refer to themselves. Okay, B. B means bisexual. A person who has the capacity to form enduring physical, romantic, and or emotional attractions to those of the same gender or to those of other genders. Now, people may look at this differently through their lifetime. In fact, one of my patients who I first got to know her because of her raising with her partner, another woman, their son, who came to me first as their practice many years ago. In speaking to her more recently, just in the past couple of weeks, she even said to me, I'm really looking to date again. And I was asking about her former partner. And she says, but I actually think now I'm actually looking now for a male partner. I'm actually looking for a male that I want to date. And we just kind of went on with our conversation as it went. But certainly, it's not that these are people who are out there necessarily attracted at the same time, who are dating people at the same time, that they're can't be in a monogamous relationship because of this. But this is just that sometimes they may have an attraction towards one sex, and sometimes they may have attraction to the other sex. Transgender. This is an umbrella term for people whose gender identity or their gender expression differs from what is typically associated with the sex that they were assigned at birth. Many transgender people are maybe even prescribed hormones by their doctors to bring their bodies into alignment with their own gender identity. But that is absolutely not required. And a transgender identity is not dependent upon physical appearance or medical procedures. So that's very important. A person does not necessarily, because they're undergoing a process, does not necessarily mean that that's the only thing that defines them as being trans. And Q. Now, Q actually has taken on two different meanings, or the letter can stand for two different things. The term queer. Now, this is an adjective used by some people whose sexual orientation is not exclusively heterosexual. So all of the other terms that I mentioned, some people may refer to themselves as queer for any of those. And so it's something that some people may feel that those terms may be just too limiting for themselves, but they're more comfortable using the term queer. It was once considered a pejorative, a negative term, and some in the LGBT community are now trying to take ownership of this word and to look at it in a more positive light. But Q can also mean questioning. Some people just don't necessarily know where they fall in all of this. They may be questioning themselves, but they haven't really come to a determination. And of course, things can be changing as time goes on as well. So that's kind of what some of these basic definitions are. So
Great.
There you go.
And it's interesting because I want to say that even within those definitions, we used a lot of terms that may be misunderstood. And so we're going to circle back in a little while. And I'm going to talk a little bit later about some of the terms that Dr. David used, such as gender identity, gender expression, sexual orientation, sex characteristics, because those are very different concepts. They are not the same things, but they're often interchanged. So one of the things I want to do next is talk about your experience. You're a pediatrician. You've been working in this field for 25 years as a clinical pediatrician. You have a reputation in the community as being open-minded, as being patient-centric, as being family-centric. And I know from discussions that we've had that you've had a growing number of LGBTQ youth in your practice. So I'm wondering if you could talk a little bit about your experience as a pediatrician with working with that population, but also whether or not you've seen a shift in the time since you've been practicing over the last 2.5 decades.
I'm going to tackle that second question first, because as a more seasoned veteran in the pediatric field, coming up on, this is my 25th year of being a pediatrician. Also, so typically a younger pediatrician is seeing younger patients. And so all the time I was, early in my career, I was seeing 5-10 newborn patients per week. But they have grown with me because part of what we do here at our practice is we are looking at forming long-term relationships. I remain the doctor for many people who I'd seen very early on, and now they're full adults. So, of course, as these types of realizations, as people discover themselves more, it is obviously more likely to come up in the second decade of life and afterwards. So clearly I am working with more families, with more youth who are falling under some of these descriptions. I do think some of it may just be because they're now older, and so they're now more recognizing themselves, their comfort. But there's also another part to this. As people know, I am one of the more open-minded people that and you can tell me anything that you will not be judged. And so to have that level of comfort and helping raise a child into their adolescence, I really make a point of, as they get and start to turn, especially into that second decade of life, of really directing my relationship less towards the parent and more towards the youth. And in fact, once the time they get to middle school, at some point we're kicking the parents out of the room and we're just talking the two of us. And part of that, and we let the parents know ahead of time that these are private and, in my opinion, very sacred conversations, but to let the parent know that, and as well as I let the youth know, that everything that we talk about is in complete confidentiality. I have a place in my notes that doesn't get sent along to the parents and nobody can see it. And really the only thing that by law I am required to do is if somebody did express to me that they were suicidal or imminently going to hurt themselves or somebody else, By law, I do have to do something about that. But beyond that, I even tell parents, just tell the youth, even kind of break the mood a little, to lighten the mood a little bit. If I were to do that, I tell them, you could sue me for doing that. I mean, it's that clear in the law as to what I can and cannot do, and my confidentiality is to that youth. So with that, I have had patients of mine who have come out to me. If they've come out to me before they've come out to their parents. Of course, we have conversations of, is this something that you want me to be part of that conversation? Are you not there yet? At any point, do you wish for me to be there? And that's very important too. But I've also had a lot of my patients. I've had patients who have declared that they find themselves, that the gender that they associate themselves as not what they were assigned from birth, and whether it's the way they want to dress, whether they want to pursue something hormonal, whether they eventually want to pursue something surgical. Again, those are all topics, but it's a safe place for them to be with me.
Yeah, and I appreciate that. I mean, that's something that we're going to dig into more next week as we start to unpack some of the other issues that are going on in the state of Florida right now and some other places. But I think it's a very special thing to be able to develop that relationship. I think a lot of times people think of pediatrician as, you have an ear infection, you have a cold, you have a nose ache, whatever have you. But, obviously there's a nose ache. I don't know what that is, but it's great thank you. It's great that you have developed these relationships with people, because when they come to you, they're babies, and then they grow, and then they become more complex individuals. And I think that it's a testament to you, actually, that people trust you. And that, it sort of also points to the fact, which we'll talk more about in another episode, that sometimes it's actually easier for youth to talk to people who are not their parents about these types of things. That's not just even about this topic. That's about any topic. I mean, that's just, if you know a teenager, that's just the way teenagers are. Okay. I want to talk about an area of this that I know is near and dear to your heart. I know it's part of why we decided to do this episode. Going back historically, homosexuality, as it was defined by the American Psychiatric Association, was considered in the DSM, the Diagnostic and Statistical Manual. It was considered a psychological disorder in 1973. So we're going back almost 50 years now. The APA actually removed that classification and said it was not a disorder, which was a pretty big shift, although society has kind of moved along a little slower than that. But even with that that being removed from the DSM, there is, and even with things having shifted in terms of gay marriage and in terms of some other things that have occurred within the last generation or two, there are still considerable mental health implications that are very specific to the LGBTQ community, and specifically LGBTQ youth. So I want to talk a little bit about, have there been any comprehensive studies, like real, dirt and potatoes kind of like studies on mental health related to LGBTQ youth?
There have been, and before I do that, I do want to do a tip of my hat to the American Academy of Pediatrics. The Academy of Pediatrics has been at the forefront of advocacy for LGBT youth, education. It's one of the positions of the Academy of Pediatrics, and this is probably one of the I'm most closely aligned with. I'm very proud of my organization that I'm a card-carrying member for, how this is continually, and it's right in the forefront of the organization. And so I do want to give my hats off to them, because I get so much information from the Academy of Pediatrics that it's very much helped me inform my decision as well. Mm-hmm. Now, the largest study that has come about from what's called the Trevor Project. And the Trevor Project actually is an organization that started off basically as crisis support for those in the LGBTQ community. They have a hotline that they have set up. The information also will be down in the notes down below for anybody who wishes to access it. But in 2019, they have done the most comprehensive study of LGBT youth, I believe, that's ever been done, where they literally, and so it's just a wonderful thing that they've been able to do this, because they've given us so much more information. Yeah.
So to give a little bit more background on that, as Dr. David said, this was the largest survey of LGBTQ youth, mental health specifically, that was ever conducted, certainly in this country. It provides a critical understanding of the experiences that this community has, as opposed to people on the outside looking in and telling them. These were actually done through surveys, interviews, that kind of thing. It was a cross-sectional national survey of this population, so it was widely diverse and representative, and it included over 34,000 respondents. So it was quite a sizable population. So there were many statistics that came out of this study. And I know that one of the ones that really has pushed your heart, many people's hearts around this, has to do with what this study has found in reference to depression and suicide amongst this population of LGBTQ youth. Tell us some of the main findings from the Trevor Project's 2019 study related to this population.
Yeah. And, in part of my counseling and speaking individually with all adolescents, the question of, have you had any depression or suicidal thoughts is something that I do ask every adolescent. So this isn't specific to that, but certainly because of my knowledge of the higher impact in the community is something that I really want to make sure that they're comfortable talking about this. 39% of LGBT youth have seriously considered attempting suicide in the past year of the study, so on an ongoing basis. And more than half of transgender and non-binary youth have seriously considered suicide. 71% of LGBT youth have reported feeling sad or hopeless for at least 2 weeks in the past year. So the overwhelming majority of these youth are having these feelings. It's incredibly sad. It's really, it bothers me tremendously because the reason for this, in my opinion, is so much about it's because of how society views them and how society interacts with them and how society tries to define them or change them. And that's just that just gets me at the core.
Yeah,
It really
and we're going
does.
to move a little bit to that into a second when we talk about some of the findings related to acceptance. I wanted to say that it's not even that 40 almost 40% of the population and more than half of the transgender youth have had feelings of depression or suicide. This study said that they actually considered attempting suicide. So suicidality is a spectrum. Lots of people have passing thoughts. Oh, I wish I wasn't here. Oh, life is too hard, this, that, and the other. But it is considered a much bigger situation when people have actually started considering an attempted suicide and how they would go about doing it. So I just wanted to point out that distinction as well in that finding. So in terms of acceptance, I'm just going to read this one really quick and then we're going to move into it. In terms of whether or not people in the LGBTQ youth community feel like they're accepted by their peers, by their loved ones, by society, by media, by the government, etc., 2 out of every 3. So what is that, 66% roughly, if I'm doing my math right, of the population reported that somebody tried to convince them to change their sexual orientation or their gender identity. Right. So in addition to all the other pressures that youth are under to conform in various ways, the overwhelming majority of these people were told that who they are, what they feel is wrong, and that they should try to change it. Right. Now, there's also something called conversion therapy, which has been banned in a lot of states, if not all at this point, I think, where basically people are sent away to these kind of boot camps or similar kind of things. And they're basically, if their parents or somebody else's, or if they've determined that they're gay, and they basically try to convert them to being heterosexual. And that has been debunked. There is no science behind it. It has been banned. The medical associations have come out against this. That having been said, those who have undergone conversion therapy are more than twice as likely to attempt suicide, not even to think about it, but to attempt suicide. So there is a lot of pressure on these people. What about discrimination and bullying? What did the study find as far as that?
Yeah. So 71% of the LGBT youth reported being discriminating due to either their sexual orientation or their gender identity. 58% of transgender and non-binary youth report being discouraged from using a bathroom that corresponds to their gender identity. So again, huge numbers in terms of just feeling discriminated against.
Yeah, and there's both feelings of being discriminated against, and then there's also policies that go into place that are actually discriminating against. And again, that is something that we'll talk about in another episode. You want to shift gears here a little bit? I know we're throwing a lot of, so far in this episode, we've thrown out a lot of definitions. We've read a lot of our notes. We've talked about, statistics. Let's get a little more personal here. So where are we going to go?
Okay, so first of all, with an understanding that this is not a comprehensive conversation, it would take hours, days, perhaps years to really dig deep to coming up with the proper solutions, understandings, education that's appropriate for everybody. And again, understanding that, a lot of the links of what we're talking about is down below. Now, I know that this is obviously an important subject for you personally, as it is for me. Um, and I'd like for you to kind of share some of your perspective and what you're comfortable sharing with our audience.
Sure. Okay. Well, so when we first started talking about this, David, when we were doing our pre-production meeting, you had asked me a question of how comfortable am I as far as getting personal on this as somebody who is in the LGBTQ community? How open am I willing to be? What am I willing to share? I thought about it a little bit, but in the end, what I really came down to is that this isn't really about me, because I want to be able to speak openly in the hope that even if one person, one parent, one teacher, one neighbor, one youth was watching this program and was able to gain from listening to me the fact that they are okay, that they are normal, that there's nothing wrong with them. As somebody that grew up non-binary, which we'll get into that in a moment, as somebody who identifies with the queer community, I did not have role models growing up, and I grew up in a fairly progressive area with very loving parents, and who I really do believe, accept me for who I am to the best of their ability. And yet there were still certain things as a youth that I never would have told anybody that I thought I would go to my deathbed with. And a lot of impact that had on me. So as a result of that, I feel like I have a responsibility to the next generation to say, it's okay, and we're going to be real here. So let's talk about some things. David, if that's okay, you want to sort of set the stage here a little bit about why we're even going to talk about some of these topics?
Yeah, absolutely. And, while recognizing that this is about you, just, it's interesting because I also have just distinct memories growing up. You were my best friend growing up. And part of that is because you had a lot of the interests that I, as a boy, had. Who was the person that would always go out and have a catch with me? Who's the person that I would hit a T-ball to and it bounced up one and knocked out your two front teeth?
Yeah, thank you for that.
Of course. Hey, we got to bring some of this stuff up. Who is the person that actually cut their hair shorter, sitting on top of our swing set, little playhouse, and got to watch Mom's reaction as she experienced that you had done that. And so, of course, living as your brother. And again, back then, obviously, I didn't know from anything. It wasn't until much later during my residency, when I was living in Tampa the first time, that you came out to me and you shared with me, and why you wanted to move to California. And so, some of those types of things, as I would look back, I'm like, well, of course, Shari was. Or back then, Shari was identifying herself. And so, again, just being there with you and being there as a supportive person for you is something that I obviously take to very much heart, and recognizing how I was able to handle that without, obviously, there was no playbook for the sibling of a person who was in the LGBT community. And yet I do feel that our parents were, because of how they allowed us to express ourselves, was also very much as to where that is. Now, let's talk about the term binary. Can you share what that means?
Sure. So, binary it's very clear. Yes, no, on, off. There's two choices. There's nothing in between, right? We have a bicycle. It's got two wheels. Bi means two. Bisexual means you're attracted to both genders or whatever have you. When we talk about binary in the terms of gender, there is, in our society, there is male and there is female. Now, I will point out that there are other cultures that there are third genders too. So this is not exclusive in the human race that there are only two genders. I'm not going to go down that path right now. That having been said, very few things, and I know you've talked about this on this show, very few things in life are actually binary, right? Most things are a spectrum. The autism spectrum disorder, you have cognition spectrum disorders. I mean, there's so many things of which there's gray areas or there's leanings in one direction or another. And gender is one of those things. There is male assigned at birth, there is female assigned at birth, and there are certain traits or certain assumptions and stereotypes that go along with that get put into play. But a lot of people do not consider themselves solely in one camp or another. They consider themselves non-binary. I consider myself non-binary. So that's just sort of a first general thing. When people hear the term, oh, they're non-binary, that's kind of what they're saying. So I want to start by talking about four very important terms that I think are commonly misunderstood, used interchangeably, and used wrong. One of them is just the fact that when you talk about sex characteristics, you're literally talking about internal and external sex organs. Even those are not always binary, but that's, sometimes doctors make a call at birth based on what they're physically seeing, and they decide this is a male or this is a female. But even that is not as binary as people would like to think. There is some gray area even there. Did you experience that at all when you were in med school or when you were coming up at all? Was that something that was discussed?
Yeah, I mean, every now and then, occasionally a child was born that had an overly enlarged clitoris that it was not and could be mistaken for a penis. There were babies who were born with micro penises that you could barely tell that what was going on there. And of course, this was externally. We're not talking about necessarily do they have testicles or do they have ovaries? Because obviously that's further along.
Right.
But not just that. So when we talk about X as genetically female and XY as genetically male. But there are also chromosomal abnormalities, XXYs, XYYs. And so, I mean, I've even said there's XXXY. There are these different where, just like how there could be Down syndrome, which is an extra 21st chromosome, there could be an extra X or Y chromosome as well for people. So again, not just to what people are looking like outside, but even on the micromolecular genetic level, there is ambiguity there as well.
Right. So, we're talking about biology here, right? There's primary sexual characteristics, and then there's secondary sexual characteristics, and these have to do with things that come along later with puberty, such as breast growth, Adam's apple, thicker hair development, menses, hormones, those kind of things. And those are all in a category of sex characteristics. They're very biologically based. There's interesting thing is that the next topic I want to talk about is gender expression, because people are like, well, what is gender expression? Okay. Well, gender expression is basically how a person is presenting to the outside world. And when you and I were talking about this earlier, one of the things that I've talked about with friends and that I realized is that gender expression is at play before a child ever even has any word or anything to say about this, right? We hear about gender reveal parties, right? So somebody's in utero and they've done a sonogram and they've declared already that this is a male or a female before they even put hands on the baby. And based on that, you've got a room being painted pink or a room being painted blue, or the names are being assigned. People are giving gifts. There's certain assumptions about, oh, I'm so happy to have a son. I'm so happy to have a daughter. And the baby hasn't even been born yet, right? From the moment they're born, even in a hospital, sometimes they'll put a bow on the baby girl. They'll put, a certain color blanket on the boy. That is already a gender expression. It is, in other words, with nothing else being said, it is what is the world going to perceive when they look at you based on how you are being presented to the world. So very, very small gender expression is happening without any say of the child. And so for someone like me, mom, I don't know if you remember this, mom used to say, like, from the time I was a baby, that she would try to put a dress on me and I would scream my head off, right? Now, granted, I don't know why anybody would want a frilly dress on a baby. It itches and it's horrible. Like, I don't know anybody that would like that. But I just would scream my head off until finally she stopped putting dresses on me, basically, because she realized I was not a happy camper. And, I was telling you about, so this goes towards gender expression, right? Even when I was in elementary school, if you remember at Sears, they had Geranimals, and you would basically go pick out all of the clothes that had giraffes and all the pants that had giraffes. And if you matched them together, then you were guaranteed by the Sears designers that you were going to look fantastic. Well, we would go into the girls department or the boys department, and I never wanted to go shopping in the girls department. I didn't like the clothes. I thought they were horrible. And it wasn't because I was having some big intellectual, psychological conversation with myself. I wanted to wear a t-shirt and jeans. I wanted to wear shorts. I wanted to wear sneakers. That's all I knew. I knew what was comfortable for me. And that's what that was about. So, even from very young ages, that if children are not comfortable in that, sometimes they're forced to wear things that they don't feel comfortable in. Sometimes they have to go against the stream. But there was another impact that had on me. I remember being pretty young and, saying that I wanted to take a dance class. And so I was signed up for ballet and tap, which was a joint class. Well, first of all, no boys took dance because, of course, boys don't dance. They play sports, but that's beside the point. But it's also ways that we get kind of pushed into ways based on what we're assigned at birth. But I remember that I actually really liked the dance class, especially the tap class. I thought it was really cool. But I had to wear a leotard and tights and these pointy, weird shoes with, Mary Janes. I didn't like it. I dropped out of the class. Had I been allowed to just wear a tank top and shorts, I probably would have stayed in the class. So that was a way in which gender expression was definitely affecting me in terms of the choices that I was making. Now, I talked a little bit about this. Gender expression is the outside looking in.
And if I can actually interject there also, a lot of parents nowadays, or even 2 decades ago when we started our parenting, are aware of these types of things. So we made a very specific point not to find out our firstborn's gender. And everything that we had purchased, all the things that we registered, were all completely gender neutral. They were animals, zoo animals. We weren't really focusing on should it be blue or should it be pink. And yeah, I remember, we were so Benjamin literally in the minutes, in the moments after he was delivered, we were just so overwhelmed with joy. We didn't even bother to look to see what the gender of our child was. And it was about 15, 20 seconds went by. I'm like, oh, we got a boy. Look at that. Hey, we have a Benjamin, because we had our names picked out ahead of time. And that was something that I remember that so distinctly because it was something that we de-emphasized up until that point. We were happy that we had a child. We'd struggled to have a child. We had a child, and it was great. Whatever we were going to get, we were going to get. Now, Benjamin's favorite color was pink.
Certainly was.
Until probably about age 5 or 6. Love the color pink, but who are we to tell him, oh, that's a girl's color. Oh, you should be thinking blue. But unfortunately, a lot of parents, grandparents, other people in society then start assigning a color. It's a color. It's ridiculous. It's a color.
Yeah.
And so, so that was, yes, eventually once Benjamin learned that from others, the external world, not us, that pink was a girl's color, that's when all of a sudden he decided that his favorite color was blue. But that was societal upon him.
Right. Well, and it's interesting. And just to even correct you, and I don't mean this in a derogatory way, but when you were just saying about, oh, you saw the gender of your son, you didn't see the gender of your son. You saw the sex of your son, right? You saw that he was male at birth, that he was assigned male at birth, that he's male. Because as we were talking about in reference to gender identity, which is what I'm going to talk about next, gender identity is something that somebody tells you, right? You can't look at somebody and say, I know your gender, because gender is how somebody feels inside, regardless of what their sexual characteristics are. Like we talked, sexual characteristics, genitalia, organs, hormones, this, that, and the other. Those are all things that are biological. That is not defining gender, right? So I'm not saying that to insult you. I'm just saying it's really interesting because I think we really are so used to in our society throwing these terms around as if they're the same thing. And no wonder everybody's confused about it. So I want to say that gender identity is how somebody experiences themselves on the inside as it relates to gender, regardless of what's going on, regardless of how they present themselves. When I was in high school, there was a lot of pressure externally, even some within the family, just because of, normal society of what we were told we were supposed to be, where I went through a phase of wearing a lot of makeup, letting my hair grow long, wearing pretty feminine clothes. It to be honest, I felt like I was in drag, honestly. Like it didn't feel comfortable for me. I'm not saying looking back at pictures, I even look at my face and I'm like, God, I looked miserable. I didn't look happy in that picture. I looked vacant, quite honestly, when I look at some of those pictures, and it's sad to me. My point being is that my gender expression in those moments was very female, but my gender identity inside continued to be non-binary. It continued to not be solely in that camp. So it's really important to recognize that just because somebody presents a certain way does not mean that how they feel on the inside is that way, which is one of the things, even with the way I cut my hair now or the way that I dress now, it is because I'm trying to have my outside to match my insides. And to me, that's a great goal in life, right? I think that in general, we would want somebody to be able to express themselves, show themselves, be perceived in the world for who they are, right? And where those two things match. And the last thing that we want to talk about before we try to bring some conclusion to this conversation is this other topic, which actually is completely separate from gender, which is sexual orientation. Most people think that gender identity and sexual orientation are the same thing. They are completely not the same thing, which is why you hear certain terms. People may have heard certain terms like cisgender. Cisgender is basically, well, that's actually going into a different topic. When you feel like you match the outside and the inside, everything matches, you're considered cisgender as opposed to transgender when things aren't really matching up. But sexual orientation really has to do with who you're more intimately attracted to. Are you more intimately, physically, emotionally, in a romantic way? Who are you attracted to? And those are very different things than just talking about, how do you feel on this binary spectrum or non-binary spectrum. What else do you want to say about this topic? There's a lot here. We are here to educate. I think that, quite honestly, I had a question for you, which is, did you talk about this stuff when you were in school growing up?
Oh, these weren't really topics that were ever talked about.
Right.
It's And granted, we're talking about growing up in the 70s and 80s, and
Mm-hmm.
some of us have evolved since that
Right.
point.
Right.
But they were just foregone conclusions. I mean, we went when we took our graduation pictures. I was thrust a tuxedo to go checked into. You were thrust into this with this feathered hair, and were given a rose to place between your bosom as to take as part of your
Right.
senior picture. So all the
Right.
girls had flowery bosoms. I mean,
Right.
gee, that's not supposed to be conformist in any way, right?
Right. Right.
That was just a purely natural way of going. And it's not like, I don't know, were you given a choice? Were you given a flower in your bosom
Oh,
option
I was absolutely
or
not given
not?
the choice. Well, we were given actually two choices. We had the celebrity pictures, which was actually not just a flower, but it was a boa. It was off the shoulder boa,
Yes.
right? And then there was a rose, fake rose, put in between the cleavage for a 17-year-old girl. I tell you, and it looked like a porn star. Is really what it looked like. And that wasn't the picture they put in the yearbook, though, because they know people would have freaked out if that wasn't put in the yearbook. What was put in the yearbook was like a matronly dress of all black. So, but no, we were not given a
Oh,
choice. Now some high schools do give that choice. Do you want to be in a suit? Do you want to be whatever? We'll talk about that some other time. But I think the most important thing to just take away from this show in terms of the ABCs of the LGBTQs is that even people like you and I, right, sometimes struggle with these terms. We've both made mistakes in this show. I think I am completely clear and okay saying that you and I have both said wrong things in the show. We've used terms of show wrong way, even as we've been trying to explain what they are. It just goes to show how complicated this is. It just goes to show how important it is that we have grace with each other. And it's also, what else do you want to say? What's important to you, David, as we wrap this up?
well, certainly a famous quote that many people know is love thy neighbor as thyself, right? Which is interesting in two ways because, first of all, how we want to be treated is how we should treat other people. But it's also sad because, some people in the community almost they have like this self-loathing, this self-hatred because of the fact that they feel that they are the wrong. That they because they're not being accepted, that there must be something wrong with them. And of course, having these types of videos and these types of educations, and again, the way the Academy of Pediatrics has presented itself, are all just like little chips away at that to let a person know that they are inherently right, that they're inherently good, that they are who they are, and that's all that they can be. And that I realize that some people may say, it'll just be easier if I act like a boy. It'll just be easier if I date a girl, because that's what society wants. And again, everybody, I guess, has that ultimate choice. But when you're an adolescent, you don't know that you have those choices. You haven't evolved those types of feelings yet. You just see what the outside world is putting on you and how you are trying to interact with the outside world. Thankfully, there are many more youth these days that are more comfortable, and more importantly, or even at least as importantly, how much of this youth generation is so much more accepting of those that are different than them. And that's something that I'm really seeing, and something that I'm really proud of this generation of youth, because I've seen an absolute shift. And certainly when you hear about rallies that are going on, and people who, whether they're in the LGBT community, they are friends of the community, they are there to go to rallies, they're there to support them, and that's something that you and I did not have. And so it's nice to see, for as crazy of a world that we're living in, that there has been an evolution. And in a way, if the adults would get out of the way and let the kids just be kids and figure it out themselves, maybe in a better place.
Yep, absolutely. So why don't we wrap it up there? I know we're going to have another discussion that will actually tail right off of that. And just thank you so much for having me back on the show. I really appreciate it.
Absolutely. And of course, if anybody has not yet subscribed to our YouTube channel, please do so. We are getting closer, itching closer to 1,000 subscriptions. So that was one of the first goals we set for ourselves. So hop on board the train if you can. And of course, if you like what we're putting out there and you want to be supporting of what we're doing and get some additional content that we're not putting out to everybody, please join us on our Patreon page. And all of that information is down below as well. So I hope everybody has a wonderful day and they've enjoyed this. And again, please share with everybody if you think that this is something that should be shared.